I will start with kind of one of the first lessons of politics that I think it's important to point out. Why am I here? Michael Scandrett called me. Well, Michael and I go back 25 years. I consider Michael a friend. Why? Because I got to know Michael. We worked together. Didn't always agree, but barriers were lowered. He's a friend. I'm here with somebody who, obviously, on the political spectrum is further to the right than I am. But Mitch Pearlstein is a friend. He approaches the debate in a logical, civil manner. He has convictions. He stands by them, but he's polite. So I would argue that what we see today, the elimination of general assistance medical care, that's really not the problem. And the problem is that we don't talk to one another. We shout at one another. We do not listen to somebody we don't want to listen to. We listen to people who we like to hear. Politics is a social sport. It demands interpersonal communication and contact. That's the lifeblood of it. You can't desocialize a social sport, and politics is a social sport. I recall one other process that I engaged in with the Center for the American Experiment after the prolonged session. We looked at, are there some things we can do? And I went to see, of course, the wizard of all the rules of the legislature, our friend Peter Watson. And so I sat down with Peter and said, now, here are some suggestions we want to make, but I want to kind of vet them with you first and see what you think. And he listened attentively, and he smiled at me and listened. And we get all done. He said, Senator, said, you can write all the rules you want. It doesn't make any difference if people aren't willing to sit down and work together. It doesn't make any difference. On the media side, it's not just kind of the mainline news outlets that we have, it's also the paid media that really distorts. And this is too good. Can't pass this one up. So here's an ad that was featured in the paper today. Does that get your attention? Yeah. Why? Because every one of us have been there, right here. Just add anything to the debate. New health care plan. Not all it's cracked up to be. That's a great line. It doesn't add anything to the discussion and the debate, but it gets a lot of attention. I do not tell legislators what to do. I am going to tell you, though, what I would do if I was there. Let me just also add this. I was there when we created it, so I had the history with it all. And one of the things I reflect back on, and this is probably more a 90s thing that I experienced, was whenever I talked to legislators from around the country at different states, they would ask about, we read about this program that you put in place dealing with seniors or dealing with the environment or dealing with this or that. And they'd say, how'd you do that? I'd explain how we got through it. And they'd invariably say, we could never do that in our state. We could never do that here. In the healthcare area, they'd say, well, what are you doing? Why does Minnesota why are you always at 1 or 2 in terms of the uninsured? If you think about it, we had a number of things taking place. Number one, we by and large have more generous employers who provide health insurance. That was one of the factors, key factors. We have a lot of nonprofits who get involved in various ways. And then in terms of the government side, we would identify a certain area and then try to target a program to that. General assistance medical care, Minnesota Care. Add it all up, and we would come out fairly well. So that was kind of the history of it all. Why was general assistance medical care vetoed in the second year of the biennium? Okay. Secondly, why, when the governor then had to take this next step, kind of unprecedented unallotment process, why was it March 1st? Well, if you think about all of that, you can draw an assumption. And to me, the assumption is this: the administration is open to a resolution. The Commissioner of Human Services has offered a proposal. The assumption you can draw from that, to me, is that the administration will not offer any other proposals or any other suggestions. The assumption that I come to is that the administration is leaving it up to the legislature to come up with an acceptable solution, and that's the operative part, an acceptable solution. Now, what other assumptions can you make? Well, based upon past actions and as well as comments I heard on the radio minutes before I walked over here, there will be no tax increases. Also, based on past practices, you can also come to an assumption that revenue raised under some other name might be acceptable. And I think, to end my assumptions, based upon the past and the fact that 2010 is an election year, I think you can assume that an override strategy is highly unlikely to be successful. Just the sheer politics of it all. What's important in this is timing. You have to have an end game in this business. That is how this all works. You have to know what it is you want done and by when. Now, you know the clock runs out March 1st, but the game is well before then. So you have to figure out what it is you want and then figure out the timing of implementation. I also think it's important in timing is to consider this a two-step process. Now, there's a reason for that, and that gives legislators some out to say, we're going to revisit this. I would look at this kind of using the phrase, this fix it now. I would say we need a fix it now strategy. We have to do something as quickly as possible to address the issue between March 1st of 2010 and June 30th, 2011. Then, second, let folks know. Listen, we're going to be back in January of 2011. In January of 2011, we can revisit this whole issue. More than likely, we're going to revisit it for the time period from July 1st, 2011 to the federal fix, if there is one. But I think you ought to look at it in two steps. I think you have to try to figure out some first step to draw everybody together, because it does, in fact, it's going to require bipartisan agreement and efforts. And I'd start with something real easy. And I'd try to get all four caucuses to agree that, if nothing else, you know, this is a high priority issue, and we need to begin hearings at no later than in January. You are not remodeling a house here. You're not remodeling the house. You're not going to fix the roof on this house. You know, you're not going to move some walls. This house is gone. You have to start with a whole new blueprint. You know, a design that's implementable. It has to be reduced in size and scope. I'd capitalize on all of the field work that's been done by all of you and all of the others that have been involved with this issue. You've done worked on educating the public. I think we have a ways to go there. You have agonized and brought forth a number of different proposals. I would capitalize on that. Again, try to reach a broad-based bipartisan support as much as possible. I'd also focus on the fact that we're all in this together. This is not a Hennepin County issue. It's not a Ramsey County issue. This is an 87 county issue. And everybody ought to be in this one together.